Hi guys, welcome to my Dowlat Form 2 revision series, and we're looking at topics covered in Form 2, normally at the end of the academic year. So this topic I'm going to touch on today deals with diseases. So when we talk about a disease, one of the first things we have to consider is the definition of health and the definition of disease. So health is defined as a state of social, mental, and physical well-being, and it is not only characterized by a lack of disease. All right. Now, disease is a condition where the human body is impaired in some way, whether it is through a structural or an organ malfunction. Now, when a disease occurs, there are two ways, and it leads us to two primary categories of diseases, and they are transmissible or non-transmissible, basically meaning infectious or non-infectious. Okay, so let's look now at a proper definition of disease. A disease is the process of homeostasis which maintains optimum conditions for the body to function. Homeostasis is a state of constancy. So you would want, when you have homeostasis occurring, all of your conditions are maintained. However, sometimes the mechanisms of homeostasis cannot cope with the changes in the internal environment of the body. And a person in this situation will show signs and experience symptoms, right? So there is some deviation of normal functioning, of consistent maintenance of bodily functions. And you would consider homeostasis to be where the body functions in all of its different systems, such as your circulatory system, your respiratory system. And if there is some deviation from that, then that is categorized as a disease. So as I saw previously, we said that there are two categories of diseases: infectious and non-infectious. So infectious diseases are caused basically where you have a microorganism, and we saw that earlier in the term, where a microorganism is one which is only visible under a microscope, and these microorganisms are categorized as pathogens, because a pathogen is any disease-causing organism. Okay, so infectious diseases are normally passed on when the pathogens are transferred from one person to another. So it's primarily through contact. Non-infectious diseases are not passed through contact. All right, so let's go through again differences. A transmissible disease is one which can pass from one person to the next, such as a common cold or AIDS. And a non-transmissible disease is one which cannot pass from one person to another, such as diabetes and cancer. So if you look at this diagram here, I'm just going to enlarge it a bit. You are seeing different ways that you have transmissible diseases or infectious diseases occurring. So you can have cholera bacteria present in infected water. You can have fungi in direct contact with you. You can have, well, now we're in the age of coronavirus, so droplets in the air. Contaminated food through salmonella bacteria. Bodily fluids, right? All of these contain the pathogens which transmit the disease. Animal vectors. A vector is just an organism which is a transporter of the pathogen, and example being the Anopheles mosquito. So when you have a symptom of diseases, you normally would have infectious diseases giving you sweating or fever, and that's the first sign of the disease, vomiting or diarrhea, and pain. All right. Okay, so let's look now at describing a category of diseases: deficiency, transmissible, physiological, hereditary. So as we just mentioned, transmissible diseases are caused by pathogens. These pathogens could range from, and we will see that just in a little bit, viruses, bacteria. Okay, so let's talk a little bit about infectious diseases. Non-infectious diseases, sorry. So infectious diseases are caused by a pathogen, but you have different categories of non-infectious diseases. So they can be degenerative, where you have some decrease in organ and tissue function as they get older, and it is thought to be due to changes in the body chemicals, such as heart attack, cataract, hardening of the arteries. Deficiency diseases is basically where you are lacking a vitamin or mineral in your body. Allergies are where you are sensitive to some antigen in the environment. environmental factors where you may have some trigger of the environment, such as like if you are overexposed to UV rays, it could lead to skin cancer. Inherited diseases are basically diseases that you get from your family lineage, such as maybe diabetes, sickle cell anemia. Psychological diseases are mental diseases, and they work where the brain leads to abnormal behavior. All right, and you can also have another category being self-induced, where you have lung cancer, something is bad for you, but you continue to do it. Okay, all right, let's move on now to going back to pathogens. So pathogens are defined as parasites, and any organism which affects the body to cause disease to it is described as a pathogen. So you will find that pathogens secrete poisons or toxins, and they are very easy to multiply, which is why you get sick so easily. So once you have the pathogen penetrating the body, they will begin to multiply in your cells, and that is what causes you to get sick. So it normally triggers an immune response, and that is what we will see a little later on in the next video. There are many pathogens causing diseases. So I gave you some examples, one being viruses. So we know a big virus now is the coronavirus. And as we saw earlier when we were looking at microorganisms, viruses normally survive only in a host where they begin to multiply and they feed off of the host, right? So you have a viral infection. You can also have a bacteria. And some of the more infectious bacteria are bacteria that cause tuberculosis, right, which is one of the more infectious diseases worldwide. All right, how do you prevent the spread of diseases? Okay, so there are many ways you could prevent the spread. The first thing is that you have to make sure that there is no break in your skin, because any little cut or any opening is what allows the pathogens to enter, even through your eyes, your tears, your mouth, your nose, all of these things. Your stomach also produces an acid that most of the times destroys any bacteria in your food. If you want to stay away or prevent the spread of airborne diseases, you stay away from crowds, wear a mask, and that's the norm now in society. Quarantine infected people, be careful of what you eat and drink, make sure food stuff is not out for long periods of time where you can get bacteria. Also make sure that drinking water is clean. All right, and also immunization is very important, but there are some infectious diseases that you may not be able to get immunized from, right? Okay, so when you talk about immunization, that's basically where your immune system learns how to respond to a certain pathogen. So when you go by the doctor and you get a vaccine, it's basically a weak strain of the virus, right, that you are normally injected with, and your body learns to produce an antibody to combat that, right? So an antibody is produced by the white blood cells in your human body to fight the disease. And there are two main categories of white blood cells. You have phagocytes, which engulf your bacteria and break it up, and then lymphocytes, which have memory, which begin to just produce antibodies to combat the disease. So vaccination is an important part of disease prevention. Okay, so this is what we'll be moving on in the next video. In the next 3 videos, I'll be doing 1 video each regarding malaria, salmonella, as well as AIDS. Those are the 3 main diseases you are required to know according to your syllabus.